Hello, and welcome to Community Posts, a bi-weekly CAN TV program featuring local leaders and organizations focused on improving the health and well-being in the city of Chicago. Community Post is presented by Foxglove Alliance, a public health care coalition supported by the Hectone Institute of Medicine. It's also in partnership with the Healthcare Council of Chicago, HC3, and it's also managed by Third Horizon Strategies and Hectone Nurses and the Humanities. My name is Takora Love. I am one of the Community Post rotating co-hosts. I am with the Hectone Nurses and Humanities and AMSN, Academy of Medical Surgical Nursing. In celebration of Nurses Week / month of May, Community Post is pleased to highlight the significant role and impact of Hectone Nurses and Humanities and increasing the awareness of art and the humanities. Today, we are fortunate to have Mary McDermott with us today. Mary Ann McDermott is a professor emerita at the Niehoff School of Nursing, Loyola University of Chicago. We'll get into a little bit of Mary's background, but we also want to say that Mary, Dr. McDermott, assisted in founding the Hectone. She's a founding president of the Hectone Nurses and Humanities organization, which is affiliated with and funded by the Hectone Institute of Medicine in Chicago. Welcome, Mary Ann.
Thank you.
We are so happy to have you. Would you like for me to give your background, or would you like to tell us a little bit about your nursing background?
I'll let you do it. You probably can summarize it more quickly than me.
Perfect. I have had the pleasure of working with Dr. Mary for a very long time, several years. Definitely an inspiration and a guiding light. I'm definitely fortunate to have this opportunity to work with her, as well as to be able to interview Mary. So Mary began her nursing career in 1960 as a visiting nurse with the Evanston Visiting Nurse Association. And then she transitioned to obstetric and pediatric staff nursing and teaching at St. Francis Hospital here in Chicago.
Evanston,
yes, Illinois. After completion of her master's degree at Loyola in 1969, she initiated a 30-plus years of teaching at Loyola. That's phenomenal. Wow.
Survivor.
So you've educated a lot of our nurses.
Yes.
Wow. And as a fellow educator, I am always in awe and very pleased. Thank you. Some of the additional things, Mary has served 19 years as a site visitor for the National League of Nursing for Accreditation. Mm-hmm. Phenomenal. And prior to retirement, she served 3 years as the Director of Faith and Mission for the university. Okay. And lastly, in the 1980s, Dr. McDermott also assisted in founding the Parish Nurse Movement and Health Ministry Association, and contributed chapters to and co-edited 3 books on parish nursing. Oh, I would love to hear more about parish nursing. All right, so we'll get right into our questions. Can you tell our audience about Hectone Institute and Hectone Nurses and Humanities?
Sure. Hectone Institute of Chicago is a grants management organization, primarily. They are also a grants giving and a not-for-profit who have an educational arm, and that's where the Hectone Nurses and Humanities comes in. Way back in the early part of this century, had the pleasure of working with a woman in the art gallery at Loyola, the Darcy Gallery. She was the curator, and she cooperated with people from Hectone with medicine and the humanities. And I went to a number of their programs just because it was convenient, often held at Loyola or downtown at our Lewis Towers Water Tower campus, and met Dr. Denea, George Denea, who came from Hectone. And after attending a number of those programs, he said, Mary, why don't you start a Nurses and the Humanities? And I said, well, nursing does not need another organization. We have plenty of them. However, we would be glad to take your money, funded, and put on programs and follow kind of some of the types of things that medicine and the humanities have been done. One of their programs that I was most impressed with was called Medicine Off the Canvas, which was primarily art. But art, history, philosophy, music, literature, the
genres.
whole array of the humanities. I think often because most recently our group has concentrated on art.
Yes, true.
Forget that all those others are part of the humanities, and we have done programs primarily for nurses to explore their probably early on life experiences that have dropped out of their life.
Yes.
They'll often say, oh, I used to draw, or I used to like poetry, I used to go to the theater, but when I came into nursing, either as a student or certainly into the profession, I had no time. And
so true.
So we're trying to push that rekindling of that interest.
Yes. I will certainly say once I joined Hectone, because you're right, I used to take photos, I used to write poems, and, joining Hectone, reignited that, Right now, it's a part of self-care for myself, take that time to, snap a photo. We have our phones in our hands all the time, and it's a really good camera, but also with, poetry. You have a pen, again, we have our phones, get it out of your head and get it down. So I love it. All right, Florence Nightingale, in honor of Nurses Week month, she's a godmother of nursing. She states, nursing is one of the fine arts. I had almost said the finest of the arts. How would you describe nursing as an art?
Well, I think art and the artist make life more interesting, seek out the beauty in life among sometimes the tragic.
Very true.
I guess to sum it up, make life more wonderful. And I keep thinking, if the artist does that, isn't that what the nurse does too? Every day, whether it's nursing a particular patient or their family, or in community health, the community.
Yes.
So I think, making life more wonderful for people most of the time.
Yeah. True.
Nurses have their down days too, or, challenges. But I think when I think of who the artist is, I think, isn't that what the nurse is? Making life more interesting, more wonderful, seeking out the beautiful.
Seeking out the beautiful. I love that. I love that. And we most certainly need that, now more than ever. Seeking out I love it. We may have to put that down on a t-shirt. I love it. So the mission of Hectone Nurses in the Humanities, and I'm going to read that just because I cannot remember it. I should, but
it's old. We had a lovely consultant, Carolyn Smeltzer, who was a nurse, but she was also worked for Coopers and Lybrand as a consultant, and we got her gratis to spend a day with us some years ago, and came out of that day with a mission. I mean, we're talking probably. We founded in 2006. Probably by 10, we realized we need to be more clear about who we are.
I love it. And Carolyn Smeltzer will be featured in an upcoming interview, so definitely stay tuned back in to catch that interview. So the mission reads, the Hectone Nurses and Humanities Advisory Committee provides humanistic, creative, and educational opportunities to clinicians. We endeavor to expand the imaginative horizons and explore the arts as a source of healing for the self and for providing compassionate and holistic care to others. Our interactive art-focused programs offers opportunities to network outside of the healthcare arena and to explore the untapped healing potential of creativity. Mary, what are some community initiatives that drives the mission?
Okay. I'd say our linkages with arts organizations around the city. Chicago is rich.
Yes, it is.
In resources. And so one of our first one was certainly linking up with the Art Institute of Chicago. And they were doing a program already, I think with U of C, with physicians on the art of seeing. And so with their guide, their person in charge of educational initiatives, we did several programs there looking at art and noticing. How well do you notice?
Yes,
What do you take in? And people would, we'd look at one particular painting, drawing, piece of ceramic sculpture. But people then would have to go out of the area, write a little bit of it, and then you can't imagine if there were 20 people, there'd be 20 different versions of what they saw.
Very true.
So we talked even then, one of the programs was about Impressionism. What's your impression? The Impressionists.
Wow.
Go into a room and you get an impression when you go to see the patient the first time. You can fill in the details, draw the rest later, but you get an impression. So that was one of our first. Another big one was Goodman Theater. They have a community outreach program, and we've done several programs with them. The one that was, I thought, very interesting was forming ensemble. And they talked about how actors and actresses come in sometimes, especially the understudy or the person who had to fill in at the last minute, and how they are integrated into ensemble. And of course, we immediately saw that as the travel nurse or the float.
Yes.
And how quickly can you integrate them into the ensemble?
Yes.
We might call it a team, or we might call it the staff. But their emphasis was on that. They did another one on storytelling,
which is
who was
huge.
the most memorable,
Yes.
patient
Yes.
that you had. Gave us a cue, a start. We've done Mexican Fine Arts Museum with Day of the Dead, Poetry Foundation with both a writing and reading exercise. If you've never been to the Poetry Foundation, folks, that is a beautiful resource in the city.
I have to add that on my list of things to go to over the summer.
Yeah. So I think a lot of community initiatives, linkages with organizations. We've done theater up at Loyola University, my alma mater as well, for very reasonable tickets price, but to see a lot of people have never seen live theater. I can't imagine that it was a part of my life. But for some, it's a great introduction, and to find something that's really fun and, is really great. Done some things with music, with thanatology, with the harp players that go into the homes in terms of hospice. Had a whole program on that. We did it up at North Park. So trying to use the resources of the city. And we've been mainly, until just several years ago, looking at appreciation of the arts. Not that we didn't encourage them to also explore doing, but our emphasis was on appreciation. We may have to rewrite the mission now.
Yes,
because
very true.
Beginning 2 years ago, we got into the doing, and now very much into the doing.
we are. I think I've been fortunate to partake in some of those events. At Loyola, I attended Into the Woods.
Oh, yeah. Sondheim won.
It was very nice, very intriguing. I wish I would have had a chance to stay to meet the actors and actresses, the cast, afterwards and for the discussion.
We did, we had the director come, but isn't it nice to know a lot and a little bit not, as Red Riding Hood says.
Yes, no, it was very enlightening. I've also enjoyed the partnership with AMSN and the International Museum of Surgical Science, which we've been hosting a lot of our events there. And again, and I'm going to put this in Mary's voice. Folks, if you haven't had a chance to attend the International Museum of Surgical Science, please take the opportunity to go and tour this museum. It is fantastic. I love it.
Up on the drive, beautiful old mansion. Just if you appreciate architecture.
Yes. Oh, very true.
You don't even have to like surgical science.
Yes. Yes. What is your favorite genre of art? I know you mentioned earlier, several different ones. So like poetry, photography, we're trying to expand awareness of those areas. But what's your favorite?
I don't have a favorite. I grew up, I guess, with all of them. When I thought about my life in the arts, not as a doer so much as an appreciator, I've tried all the doing and realized I'm an appreciator. But had a lovely, wonderful aunt who loved poetry. She was a docent at the Art Institute. She was taught grade school up in Winnetka at the Crow Island School. But she loved nature. I mean, she loved so many things. And so enthusiastic. And in those days, called herself, quote, an old maid. So she had lots of time for her nieces and nephews. And she wasn't so much, I thought, about music. My own family, my father was, liked to sing, and my older sister could play the piano, so I got into music. But I don't know that I have a favorite art. The poetry, I said I can still repeat. A.A. Milne, James Morrison, Weatherby, John Dupree took great care of his mother, though he was only 3. It goes on and on. But I couldn't have been 5 years old. Wow. And started to memorize poetry. So, yeah.
Wow. Wow.
So I don't have a favorite.
You don't have a favorite genre. Do you have a favorite artist?
Not
or several.
Really.
Okay.
Yeah.
Or like maybe what's like your top
20?
I was gonna say 5, but 20.
No, I think, again, that aunt took me to the Art Institute, I think, at about 5, and I saw Seurat's, in the park. And it was at the top of the entry stairway. At that time, it was hung there. Now it's in a room, but it was hung right there. And I just thought that was the most wonderful scene, and then seeing the little tiny points. Later, Sondheim did In the Park with George. Had to see that to play. I bought a dress when I was in my teenage years that had the painting on it. So Seurat was early on. And I took some art lessons at the Art Institute as a kid. Nice. But again, I knew I was no artist. I liked to come down to Michigan Avenue and go to Wimpy's for a hamburger afterwards. But, was exposed to a lot of artists. I got at Loyola this time, Loyola with going to Rome, and so really got into many of the Renaissance painters and Sistine Chapel, Michelangelo, and all of that. And then most recently, probably with Frida Kahlo and Elizabeth. Well, that's somebody else. That's a whole nother story. But I guess I have a number.
Okay, that's nice. But, as an appreciator, for sure, because you can grab something from each one, that you see. Awesome. In terms of thinking about Nurses Week, we always self-reflect on not only our journey, but looking forward to the future. Like, who or what inspires you as a nurse?
I think both a number of people, certainly, and mentors over the years. In terms of incorporating the arts into the teaching, there were people from our different departments. I think one of the values of university preparation for nursing is the exposure to the humanities.
Yes.
And so there were a lot of those faculty who, when I showed any interest, reciprocated.
They latched on to that.
And, would say a lot of people. Certainly, there was John Felici, priest over in Rome, at the Rome Center, who encouraged my museum going over there with the students, set up the hospitals for me, and the hospitals are oftentimes a work of art over there.
I believe it. Wow. Wow.
So I'd say people.
People. Yes. Very good question. And then what is your future, your vision for Hectone Nurses and the Humanities?
Well, again, we've turned towards the nurse as a doer. And so when we had the exhibit 2 years ago, we didn't know if we'd have 2 people or 20 or whatever. We had 150 entries from nurses, mainly from the Chicagoland area, but up to Wisconsin border and down southern Illinois.
That was phenomenal.
And we were able to show most of them on the wall, but some had to be put on the screen and on a film loop. But when we did the post on that at the final reception, a number of nurses were interested in maybe establishing salons for the doers. Not only art, but music, poetry. So I think we have now slid over to that. I hope we continue the relationship with the community organizations in Chicago for probably the vast number of nurses who are appreciators and not doers. But
very true.
Hope we can service both.
Yeah, and looking forward to planning. I know you and I, we've spoken a lot about, going to some of those museums and having more outings and, appreciating the art. So, yeah, I think
bringing nurses together who like them. They didn't know, they thought they were alone.
Exactly. No, very true, very true. And it wasn't until I had established relationships. Like, of course I knew, like, art. Just as you said, like from growing up and, my parents taking us to the museums and, in undergrad, you have to do the intro to art class. So I learned a lot there. But I never put the two together, right, until like my adult years and after practicing as a nurse for a while. And that exposure increased when I became part of Hectone. So I think, increasing awareness and just educating people how the two intertwine and connect.
For sure. Yeah.
And just keeping it ongoing, not only during Nurses Week, but ongoing, if we can increase that awareness.
I know Northwestern has an art exhibit themselves, besides what we have over at the museum this week.
Yeah.
But I encouraged Elisa Saklak, I think, who's in charge of it. Why is it only during Nurses Week? Couldn't you take those entries and take 3 or 4 of them to each unit? And rotate them during the whole year.
I like that idea.
And we just move it along so everybody gets to see everything, but over a year's time, not a week.
No, I like that. And it's so many talented employees. Oh my gosh. I mean, like, as you stated, like, I can't draw a straight line, so I would not try to paint, but I can put words on a paper. So I did, enter some of my poetry, just to showcase it. And, last year I submitted some of my photography that I took during the pandemic. But,
and you get to know who else shares your love.
Yes.
When we had that 2 years ago at the museum, these 2 fellas, one from Rush, one from Northwestern, were both into photography. They'd entered. I brought them together for a conversation. And they were like, you too? I mean, one had a dark room. They were then going to share, they'd share space and had equipment that the other one didn't have. And, I mean, to bring people together to find each other,
Yeah.
so they're not operating in a vacuum.
Mm-hmm. That's the key, bringing people together.
Yeah.
And that's what art does. You know, I love it. So inspirational. So, I want to just circle back a little bit. What are some key points that you would like for our audience to remember about just nursing and the humanities, about Hectone?
I guess is to look for beauty in this world rather than the tragic. Right now we are living in times that sometimes challenge us to find the beauty in the day. Taking the time maybe in the morning to just take some time for self and to think about either the delights of the day before or looking forward to the day ahead, and maybe to find a compadre who shares your interest in the arts.
Yes.
Make life more interesting.
Make life more interesting and see the beauty. Rather than the tragic.
Right.
And, I just think that is so timely as we celebrate Nurses Week. We are tasked with some of the most important moments, but also some of the most tragic moments.
Right.
And there's no magic switch to be able to turn that on and turn that off.
Very true. I said I worked in obstetrics. Most days were beautiful. When it was tragic, it was tragic. And being able to step away for a moment, live in that moment, owning it, right.
And then being able to step back in. And unfortunately, with nursing, it has to continue. Right? You have to continue to be able to, you have to be able to continue to take care of the rest of your patients and going about your day. But I think, to your point, seeing the beauty in it.
Right.
Although there's very tragic things, there's a silver lining somewhere. We have to look to that. I think
and helping others to look too.
Yes.
I guess, not just our coworkers, but the patient.
Yes, and the family as a whole. Yeah. So, I think when we talk about like holistic and patient-centered care, adding that art to it, art also plays into the holistic patient care.
Yes.
Having a conversation and being able to build a relationship with a patient is art. Learning about someone's life that you're caring for, that's an art. I think that's one of the best things about nursing for me is connecting with people and learning about people. I love to hear people's stories. Like, who are you? You're not just a patient or, the room 1033 or the patient with this disease. Who are you as a person? So I also think that that's the humanistic part about nursing.
And how do they renew? I mean, reminding them for themselves.
Yes.
How do they renew themselves? Yeah.
I love it. Well, I can talk to you all day. I love being able to converse, and we're both very passionate about nursing, education, as well as the arts. I'm looking forward to our continued journey, at Hectone and
I'm glad there's a whole new generation interested. When we started, I got my own peers. And we're all now in our 70s and 80s. So turning it over to the young is a delight. I mean, I wasn't sure if I'd be able to do that. You got your own baby here.
Yes.
But it's turned out fine, and the next generation is doing even better.
Oh, God, good. But, it's just a joy to have your guidance, and the peers, the previous board, the opening night of the exhibit, to be able to have you all in attendance and appreciate it. It was amazing, very amazing. But I'm looking forward to great things on the horizon. And again, guys, if you get a chance, please go check out the International Museum of Surgical Science, as well as all of our Chicago museums. They have plenty of free days and
One we didn't mention, and we spent a fair amount of time with them, is the Veterans Art Museum.
Oh, yes.
I worked out at the VA in retirement part-time, and got very acquainted with the Veterans Art Museum. And if you have not been there on Milwaukee Avenue, In fact, I think Levi, who's
Yes.
a common friend, was active there as well.
Yes, no, that's a very good point. You know, maybe at some point we come up with a list of all the museums and circulate that out because I think it's very important, you know.
Yeah, well, of course, they PTSD, and people say, oh my God, especially after the pandemic.
Oh,
fair
for
amount
sure.
Of nurses are, I mean, not
experience it daily.
Right.
Yeah.
Right.
Yeah. No, very good point. Okay, so it is time to wrap up. I would like to once again thank Mary McDermott for her time, expertise, and dedication to the art and the humanities. I would also like to thank CAN TV's nonprofit service team for their support in the production of this program, as well as the Hectone Institute of Medicine. My name is Takora Love. Thank you for watching Community Posts, which airs on CAN TV, Channel 21. It is also available for streaming at cantv.org.
So long, farewell, auf Wiedersehen, goodbye.
Thank you.